Good morning. I call this meeting of the Steering and Policy Committee to order. Thank you all for joining us today. We are meeting here under the dome of the United States Capitol to speak truth to the American people. Republicans want to take healthcare away from the American people, all so they can give tax breaks to their billionaire donors. That's why they cut Medicaid and Medicare. And now hospitals across the country are on the brink of closing. It's why they chose to shut the government down rather than work with Democrats to reverse healthcare cuts and lower the cost of premiums. Republicans are waging a war on affordable healthcare, and it is the everyday American families who are losing. But it doesn't have to be this way. Democrats are fighting tooth and nail to reverse Republican cuts to Medicaid and Medicare. We are in the courts fighting back against Trump's attacks on cancer research and the National Institutes of Health. We are in our communities making the choice we can against Secretary Kennedy's vaccine disinformation campaign. And we are here in Congress demanding that Republicans return to Washington so we can negotiate a bipartisan deal to reopen the government and stop the healthcare premiums from doubling or tripling on American families. We are here. Republicans are on vacation. We want to lower costs. Republicans want to raise them. You deserve better. Let's watch this video.
Republicans are waging a war on your health care on every front. They're gutting Medicaid, cutting coverage from millions of working families. They're going after your Medicare, shredding the safety net to lower taxes for their billionaire friends. They're defunding Planned Parenthood, blocking care for women nationwide. Hospitals are closing, nearly 300 at risk across rural America. They're pushing vaccine conspiracy theories that will make all our children sicker. And they're doing cancer research, shutting down the labs that deliver cures. From Medicare to medicine itself, this is a Republican war on healthcare. We have to fight back before it's too late.
Good afternoon, everyone. It's an honor and a privilege to be here with all of you. Let me thank our distinguished witnesses who we look forward to hearing from. Thank you for your presence. Thank you for your willingness to share your stories and perspectives and experiences as it relates to the Republican healthcare crisis and the impact that it is having on everyday Americans all across the country. I also want to thank our distinguished steering and policy co-chairs, Nanette Barragan, Debbie Wasserman Schultz, and Robin Kelly for convening this hearing, as well as to members of House Democratic leadership and members of the House Democratic Caucus who are present and on duty, fighting for people at the same time when Republicans remain on vacation after shutting the government down because of their unwillingness to address the healthcare crisis that they have created. House Democrats remain ready, willing, and able to sit down with our Republican colleagues anytime, any place, in order to reopen the government, to reach a spending agreement that actually meets the needs of the American people and improves their quality of life, and that addresses the Republican healthcare crisis. And make no mistake, it is a crisis that is impacting everyday Americans all across the country. It's assault on the health care of working class Americans, of rural Americans, urban Americans, people in small town America, people in the heartland of America, and people in Black and brown communities all across America. Just this year, Republicans have enacted the largest cut to Medicaid in American history. 14 million people will lose their health insurance as a result. Hospitals, nursing homes, and community-based health centers are closing all across the country, including in rural America, because of what Republicans have done with their one big ugly bill. They've also set in motion a possible $536 billion cut to Medicare. because of the steps that they've taken this year on a partisan basis, unless Congress acts by the end of December. Republicans have refused to extend the Affordable Care Act tax credits. And as a result, this month, tens of millions of Americans all across the country are receiving notices from their health insurance companies, making it clear that their premiums, copays, and deductibles are about to skyrocket. In some cases, double, triple, or quadruple. Married couple, for instance, that makes less than $100,000 can barely get by, currently is on the Affordable Care Act and pays $8,000 a year. That's already too much. But because of the Republican refusal to extend the Affordable Care Act tax credits, their yearly expense could triple to $24,000 a year. They will lose their health care or go into medical bankruptcy. That is not acceptable here in the United States of America. And that is why House Democrats, partnering with Senate Democrats, are continuing to stand on the side of protecting the health care of working class Americans, middle class Americans, and everyday Americans all across the land. Thank you again to our witnesses for your presence here today.
Thank you, Mr. Leader. Thank you to our co-chairs for bringing us all together. And thank you to our witnesses for joining here today. As glad as we are to have you here, we would much rather be on the floor voting to end this chaos. But look around. Look at what the Republicans have inflicted on the American people. Cuts to Medicare, cuts to Medicaid, cuts to the Affordable Care Act, cuts to children's health insurance, cuts to medical research. All of this to take that money and give it to the very wealthiest in the form of tax cuts. And then what? After they've done this, created this healthcare crisis, how do they respond to their own chaos? They shut down the government. And they're taking it quite literally because they're not even showing up to do their jobs. And they're saying, we can talk about all of this some other time. How about November? Why don't we talk about the end of November? Speaker Johnson had a quote. He said, we have an eternity to deal with healthcare. No, we don't. That's the point. They are making healthcare more expensive for everyone, but we have a particular urgency around the ACA. And let's spell out what they did. They took away the tax credits that help people pay for premiums. They chose to spend that money on permanent tax credits for billionaires. Then, when they took those away, insurance companies responded by raising premiums. And notices of increased premiums are going out over the next days and weeks. And families are finding out at home in my district that their premiums are about to double. To double. They are having to make impossible financial decisions right now. And let's go to Benton, Louisiana, right in the heart of Mike Johnson's district. A couple making $88,000 a year in Benton, right now they pay just under $7,500 a year for health insurance. That is not cheap. But now, while Mike Johnson has his members on vacation, keeping the government shut down for another week, that couple is finding out that their premiums are about to triple, that their premiums will go to more than $23,000 a year. Nobody can afford that. That is putting insurance out of reach. And that is what is happening right now in Mike Johnson's district. And it's happening to the people that he is paid to represent. And this is hurting everyone. Cancer survivors, small businesses, moms, kids, and the real kicker, 267,000 veterans will lose their insurance as these ACA premiums skyrocket. But instead of showing up for work, coming to the table, negotiating with us, they are now also spreading that pain to our current service members who are at risk of missing their paychecks and going unpaid for serving our country because the Republican Party cannot even get its act together to come and do what we do in every shutdown and agree that we pay our troops. Mike Johnson said that's a show vote. I can't imagine anything more disrespectful. But that's their response to this is that we're just not even going to show up, that we are done negotiating. We have made our bargain. It is a billionaire's first plan. So here's my plea to Republicans. If you're not going to come to Washington, walk across the street, go next door, talk to your neighbors, hear about the true anxiety they're feeling, hear about the betrayal they feel that Donald Trump told them he was going to lower costs on day one and has done nothing but make life harder and more expensive. Then get on the next flight to DC and come and work with us. Stop these premium hikes, get our troops paid, get government up and running. Enough is enough. But I am honored to introduce someone who always shows up and has spent her career fighting for the rights of every person for affordable, accessible, high quality health care. A proud alum of our Ways and Means staff and former administrator for the Center for Medicare and Medicaid Services, CMS. We are so proud to welcome back to the Hill, Chiquita Brooks LaSure. And Chiquita, the floor is yours. Thank you for joining us.
Well, thank you so much for the invitation. It is always a pleasure to be here with you. I have spent my career as a former administrator of CMS and as a health policy expert, really trying to make sure that we have a more accessible and affordable healthcare system. And I am deeply concerned about the impending healthcare crisis in our nation. Earlier this summer, congressional Republicans passed their budget bill that cuts over $1 trillion from Medicaid and the Affordable Care Act marketplaces, the largest healthcare cut in our nation's history. This, along with other actions and inaction, puts 15 million people at risk of losing their healthcare coverage. The first effect will be sticking over 20 million Americans who receive coverage through healthcare.gov or state-based marketplaces with a bill that doubles their health insurance premiums next year. Marketplace premiums will skyrocket by hundreds to thousands of dollars. People could start to see this sticker shock starting on November 1st, which is in just a couple of days from now, when people go to sign up for their coverage for next year. I really want to put this in the context of the average American. About 1 in 2 American workers, about 2 to 3, 2 out of 3 American workers are unable to pay a $500 emergency expense. This means that for so many Americans, they are one bill away from being in a very difficult place. The impact of these premium tax credit cuts could mean that if your roof leaks, you can't pay for that and your health insurance. Or if your car gets flat tire, the car that you use to get to and from work, these are the costs that we are talking about for the average American of these premium increases. Someone who makes $35,000 a year, which is about $17 an hour, will see their premiums rise by nearly $1,600 when the tax credit ends. If they try to make up this difference, they would need to work the equivalent of 11.5 hours a day for 18 days straight. This does not account for their childcare, the gas, and the other expenses that would come so that they could increase their working hours if their employer allowed them to do so. Let us not also forget just how important the ACA is for our small businesses. Nearly half of adults who are in the marketplace who are employed by a small business, who are self-employed, or small business owners themselves rely on these tax credits. On average, in a family business run by a 60-year-old couple making $85,000 a year, are looking at a premium increase on average of about $22,000 next year. We should be celebrating small businesses rather than placing excessive strain on them to afford health insurance. The enhanced tax credits not only made coverage more affordable for working middle-class Americans, it also in turn made the ACA market more stable and kept costs down for all enrollees. But I would be remiss not to mention the looming crisis facing millions of Americans and healthcare workers who rely on Medicaid. The budget law makes many changes to Medicaid that will have ripple effects that could push Medicaid enrollees, like children with disabilities, adults who are juggling multiple jobs, older Americans who rely on home and community-based services, but not just those people, but our healthcare system and our state budgets may be pushed to their breaking points. Although many of the Medicaid provisions in the bill do not take effect until around 2027, we have already begun to see the effect on our healthcare system, which will harm all of us. Over 300 rural hospitals are at risk of closing due to Medicaid cuts. In Georgia, a large hospital system announced just a couple of weeks ago that they were closing their labor and delivery unit due to the budget law. Rural clinics in Virginia and Nebraska have already announced their plans to close. We were already in a healthcare crisis in many ways. When I was CMS administrator, I would often hear stories across this country about the impact of rural closures on rural communities, from a widespread job loss due to the rural hospital being the community's larger employer to families having to drive further during an emergency. As a mother myself, I certainly understand the stress that you would think when you're here that your labor and delivery unit is closing. Nobody wants in this country a mother to have to deliver her baby on the side of a highway because she could not make it to the hospital on time. But that's the situation that we are facing in parts of our country. None of these things are inevitable, neither the shutdown nor higher healthcare costs. It is a choice that congressional Republicans and the Trump administration have made. They have created so much uncertainty in the healthcare system, uncertainty that will continue to cause more hospitals to close, insurers to raise premium costs, and people to choose to go without a health insurance. The American people should not have to choose between affording groceries or paying for health insurance. But if we continue this trajectory that congressional Republicans and the Trump administration have sent us down, that may very well be the choice that many individuals and families as early this fall will have to make. Thank you.
Thank you so much, Administrator Brooks Lesher. Thank you for your leadership and for all you have done to expand affordable healthcare access. We know when Democrats are in charge, we deliver on our promises of lowering costs and making healthcare more accessible. This has long been a Democratic priority. It is thanks to Democrats that the Affordable Care Act today provides tens of millions of Americans with coverage. But when Republicans are in charge, they do everything they can to undermine healthcare. We saw this with their signature legislation this year, which kicks more than 15 million Americans off of their health insurance. That was the largest healthcare cut in American history. And now Republicans are doubling down on the healthcare crisis they've created, failing to work with Democrats to prevent the ACA tax credits from expiring. The American people want Congress to work together to ensure health insurance premiums don't go up at the end of the year. The clock is ticking, and open enrollment begins this week. More than 20,000 Californians in my district alone will see their premiums go up from this crisis, and many will see their premiums double. Failure to extend these tax credits is not an option. We'll cue up a video.
While Republicans shut down the government, they're driving up healthcare costs for families. Their big, ugly bill cuts Medicaid, targets Medicare, and takes healthcare away from hardworking people. And now, families are paying the price. In Speaker Mike Johnson's district, a 60-year-old couple's premiums could rise by nearly $20,000 a year. That's not an expense any family can afford. While Republicans reward their donors, Americans pay the bill. That's why Democrats are fighting to protect our healthcare.
Now, someone who knows this all too well is our next witness. It's my privilege to introduce Mariah Plant. Mariah is a small business owner in Wyoming County, West Virginia, who serves as the main caretaker for her brother, Matt, who's legally blind and nonverbal. Medicaid has been a lifeline for their family. It allows Matt to live at home while covering his doctor's visits and medications. But with Republicans doing everything they can to cut Medicaid, Americans like Matt face serious challenges to getting the care that they need. And caregivers like Mariah worry what will happen to their loved ones if costs go up and healthcare falls out of reach. Mariah, thank you for joining us today and for speaking up in service the tens of millions of Americans who rely on Medicaid like your brother, Matt. You're now recognized. Make sure. There you go.
Warned me to turn that button on and I just flat out ignored it. Thank you very much, everyone, for having me and for taking the time today to hear from us citizens about how these cuts are going to impact all of us. I want to also apologize in advance for my tone. I recognize that we're all on the same side of this fight, but I got a lot of mad in me. And I want people to hear it because I represent the mad that is inside a lot of people in West Virginia, especially in rural parts of my state where we feel like we've just been hung out to dry by this whole process. I know I personally feel like I'm being attacked from all sides. Like I said, my name is Mariah Plant. I'm 29 years old. I'm a small business owner and I live in rural Wyoming County, West Virginia. I work full-time from home while also caring for my older brother, Matt, who, again, is legally blind, has nonverbal autism, and needs significant help with nearly every aspect of daily life. Medicaid is our lifeline in West Virginia. It pays for his medical care, his prescriptions, his eyeglasses, which are about an inch thick, and behavioral support, which are services that we could never afford on our own. Most importantly, Medicaid allows him to live at home, surrounded by people who love him, instead of at a facility where staff are often overworked and undertrained to care for people with complex needs. Just last year in Preston County, West Virginia, a man not much older than my brother, who is also nonverbal and has lifelong developmental disabilities, lost his life in a facility like this because it was understaffed and underfunded, and the people in charge of his care left him in a scalding hot bathtub for an hour. When they found him, his skin has melted from his body, and he was deceased. He could not cry out in pain. He could not tell them that the water was too hot. He could not even struggle to get himself out of the tub on his own. And I think of that man every time I give my brother a bath. And we switch the water from hot to cold to hot to cold to hot again to a little bit colder. And we switch out the washcloths just so. And we play the special bath time song. And it requires a lot of love and patience that I don't think somebody making minimum wage is going to be able to offer him. Caring for Matt in our home also saves the government thousands of dollars a year compared to what it would cost to house and care for an individual with similar care needs in a state hospital or assisted living facility. But now, on top of threats to Medicaid, my own health coverage is in jeopardy. I currently receive an enhanced premium tax credit, an EPTC, which reduces my monthly health insurance premium from $829, which is double my car payment, down to $218. Very manageable. That covers 77% of my annual premium cost, making it possible for me to afford coverage while caring for my brother. If these enhanced tax credits expire, my monthly premiums will nearly double, jumping from $218 to $388 before I ever see a doctor or pick up a prescription, which, by the way, the one prescription I do take will cost me another $150 a month. That's a devastating hit for working people like me. And I'm not alone. Americans across the country are opening letters from their insurers right now, learning that their premiums are skyrocketing because Congress has not acted. We are facing an unprecedented healthcare crisis. Families are watching their costs explode in real time, and Democrats have been clear. They're ready to negotiate a bipartisan agreement to reopen the government and extend these tax credits so we can stop these massive premium hikes. But Republican lawmakers have to come up off the golf course and off the beach and sit down and negotiate in good faith on behalf of the hardworking Americans like myself who they were elected to represent. You may think that West Virginians are too poor or too uneducated to know when we are being sold a bill of goods, and maybe that's what they are counting on, but there is not one good thing in this bill for West Virginia, and we are not for sale. Where I come from, the stakes could not be higher. If HR 1 takes effect, at least 7 rural hospitals, including Welch Community Hospital, which is the closest medical facility to where I live in Pineville, still 40 minutes away, but a manageable 40 minutes. 7 of those facilities will close within the next 2 years. That means more people driving further for emergencies and regular healthcare visits, more strain on our already fragile healthcare system, and more lives at risk. This ain't about politics. It's about people like my brother, like my neighbors, like my mom and dad, like my sister, and people that we love back at home. We cannot trade their health and security for tax breaks for the wealthy. It is time for Congress to do its job. Extend the premium tax credits and protect Medicaid and put working families first. Thank you very much for your time today.
Mariah, thank you for your mad. We appreciate it. While the Republican Speaker of the House has canceled 2 weeks of votes, Democrats have remained here in Washington, ready to reopen government and lower health care costs for the American people. Republicans in Congress and President Trump promised to lower prices. They haven't. Instead, the Trump tariffs are driving up costs for small businesses and consumers. The proposed Medicaid cuts would leave millions without coverage, and cuts to the Inflation Reduction Act are pushing energy prices higher. Now, as Democrats fight to protect the Affordable Care Act's premium tax credits, House Republicans are nowhere to be found. This is not what working families need. They need stability. They need a government that works for them, one committed to keeping health care affordable and accessible. Republicans like to say the best health care is a job. But even for Americans working full-time in today's economy, affordable health care remains out of reach. One of my constituents, Miss Evans, from a rural community in my district, I have 4,500 farms in my district, plus the city of Chicago, recently shared her story. She works hard in the agricultural industry and loves her job, but her employer doesn't provide health insurance. Thanks to the Affordable Care Act, she can afford affordable coverage through the marketplace. Before the ACA, many women's preventative services were not covered. Today, Ms. Evans receives annual checkups and screenings at no cost. And because she has a family history of colon cancer, the ACA ensures she can continue to receive life-saving screenings. This preventative care not only keeps her healthy, but it also saves her money and gives her peace of mind. But Ms. Evans is worried if the ACA premium tax credit expire, her monthly costs could double. She earns too much to qualify for Medicaid, yet not enough to afford a massive rate hike. If Republicans believe the answer to health care is simply to get a job, then we should ensure that every working American can afford quality health care. I will continue fighting to stop this Republican manufactured health care crisis and to keep costs down for workers like Ms. Evans. Now, I'm very honored to introduce our next witness who understands the impact ACA cuts will have on rural workers like Ms. Evans. I'm honored to introduce our next witness. His name is Dr. Bruce Pulliam, an emergency physician from Southern Oregon who has spent the last 13 years providing life-saving care in a community hospital setting. Originally from rural Northern California and raised by 2 public school teachers, Dr. Pulliam's path to medicine was made possible through government-supported scholarships, loans, and grants. Resources, he said, were essential to his ability to serve the community he now calls home. Today, he brings firsthand insight into how shrinking public investments in education and healthcare is deepening provider shortages and straining rural hospitals. Dr. Pulliam has been a strong voice for policies that preserve access to care and strengthen the healthcare workforce, particularly in underserved communities. Thank you for your work.
Good morning. Again, my name's Bryce Pulliam. I'm proud to be a board certified emergency physician, as well as a founding member and the current chair of the Southern Oregon Providers Association, which is part of AFT's Northwest Medical United Local 6552. I live in Southern Oregon and work in a community emergency room. My colleagues and I show up 24 hours a day, 7 days a week, 365 days a year with one goal in mind: to provide excellent care for patients in crisis. Being a doctor is often challenging, but it's become harder because our nation's healthcare system is on life support. Unfortunately, Republican policies are making this worse. This summer, they worked with the Trump White House to enact a partisan law that slashed Medicaid, and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. They did this at a time when our healthcare system was already at a breaking point, with a national nursing shortage and too few doctors to care for those who need us. Our nation's emergency rooms are packed. Patients receive care in ER hallways, and hospitals are so full that patients have to wait hours or days to be admitted. The television show The Pit doesn't lie. This is real life. As emergency physicians, we see patients with life-threatening emergencies like sepsis, strokes, or heart attacks. But we also pride ourselves in caring for anyone who comes through the doors, including those who come to us because they have nowhere else to turn. If Republicans succeed with policies that defund healthcare, we will see a crisis at every level of our system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 14 million people could eventually lose their healthcare coverage, and millions more will see their healthcare premiums increase. This could literally mean the difference between healthcare and being able to afford rent or groceries for the most vulnerable. If we keep cutting from our healthcare system, we aren't just trimming fat, we're cutting to the bone. That means that someone's neighbor, best friend, or family member, like Matt, will have to forego care, skip medication, or delay going to the doctor. They'll get sicker, and both red and blue communities will suffer. I know this as well as anyone coming from a red district in a blue state. It doesn't have to be this way. What we ask for is simple: protect and expand coverage, invest in safe staffing, and fund community hospitals so care is available where people live. I'm here today for my patients, who deserve excellent, affordable, and accessible care. Instead, many are about to receive notice that they're losing the tax credits that enable them to be able to afford health care. All because Republicans' budget prioritizes tax cuts for billionaires over the health of millions of Americans. It's time that Republicans return to DC and do their work. They need to end this government shutdown and work with the Democrats to restore and rescue the health care that's now at risk. I always strive to do what's right for my patients. The Republicans that control Congress and the White House should do what's right as well. Instead of creating a healthcare crisis, they should work with Democrats to fix it. The health of our communities depends on it. Thank you so much.
Well, thank you, Doctor, for your testimony. I want to thank all the witnesses for being here today. I want to thank Leader Jeffries and the congressional leadership for your opening remarks, and to the witnesses all for being here. You know, as has been mentioned, Republicans have the House and they have the Senate and they have the White House. They could end this shutdown today, but they've refused to negotiate with Democrats. And Democrats will continue to fight to protect and save your health care, and Democrats in Congress want to keep your health care affordable. In my district of California's 44th district, 22,000 people will see their health care costs increase and thousands will lose their coverage entirely. For a 60-year-old couple earning $82,000 a year, annual premiums will increase by $13,783 or 286%. That is insane. It's unacceptable. I now will recognize myself for the purposes of a question. Ms. Brooks LaSure, why is it so important for the healthcare tax credits to be extended now? And why can't Congress wait until December, as Speaker Johnson suggests?
Yeah, so thank you so much for the question. The tax credit should have been extended in April. That's when insurers start making estimates of what the premiums are going to look like. They are what we normally see in a normal year is right now, people who are on the marketplaces should be getting notices telling them what their premiums are going to be. And that's why the tax credits should be extended now. And waiting until November 1st is too late, because when people come to the marketplace to shop and have sticker shock, they don't come back. They leave when they see this is not affordable for me. And that's why it's so important that tax credits be extended immediately.
Thank you. That's such an important point. I now want to recognize my fellow co-chair, Debbie Wasserman Schultz, for a question.
Much, Co-Chair Barragan, and thank you to all of our witnesses. And Ms. Brooks LaSure, you deserve the applause as well. So don't. And thank you for your service. I know that CMS job is a hard one. Dr. Pulliam, you're on the front lines, quite literally, of our healthcare system, and I'd like a sense. Now, don't take this the wrong way, but you look like you may have been around prior to when we had more access to quality, affordable healthcare under the ACA. So, over the course of your career as an emergency room physician, can you talk about how our healthcare system has become increasingly under more and more stress, and particularly when patients can only use the emergency room as their primary access point for healthcare? What does that look like when they can't afford their insurance or their deductibles, and the first time they go for healthcare is when it's an emergency?
Sure. So a lot of parts to that question, but I think first and foremost, just to highlight, our system is under stress and stretched to the breaking point. It's hospitals across the nation facing nursing shortages. In communities, we are losing primary care doctors. We're losing specialists that patients need to see for their advanced conditions. Provider burnout, whether it's nurses, doctors, techs, is at an all-time high, and that's driving even more talented people out of the profession. And yet, what we see is patients who come in to the emergency department because that's the only place they can turn for care because they don't have a primary care doctor or they can't get to a specialist. And it's great. I have a federal mandate to see anyone who walks through my doors, and it gives me a ton of freedom to care for literally anyone or anyone that shows up. But I am not an endocrinologist. I'm not a gastroenterologist. I'm not a neurosurgeon. And sometimes to get those patients to those specialty cares that they need, one, we have to refer them. And if they don't have insurance and can't afford insurance, those visits are cost prohibitive. They are hundreds, if not thousands of dollars. And two, when our system is stretched as thin as it is, I see patients who come in who have a first-time seizure, and I say, we need to send you to a neurologist. I refer them to a neurologist. And then I see that same patient 6 months later having another seizure, not on medications, because they couldn't get to a neurologist or a cardiologist or whichever specialty they needed to get to because they're booked 6 months or a year out. Even when the specialties are available, our patients are struggling to access them. And unfortunately, the emergency department, we are jacks of all trades, and we are there to help anyone, but we can't fix everything.
Thank you. I believe we're going to our co-chair, Representative Robin Kelly, for the next question.
All right, since they were asked questions, I'll ask you. My district is urban, suburban, and rural, and as I said, I have 4,500 farms in my district, and in my district, 2 hospitals, if they implement everything they want to, will shut down. So I want you to talk a little bit more about that, the length of time people have to travel, and how close hospitals are to you now, or even federally qualified healthcare centers.
Really, thank you for that question. So in West Virginia, we have a threshold that a lot of people go by to determine whether or not seeking healthcare is worth it, right? How bad does it hurt? Does it hurt bad enough to drive an hour or an hour and a half? Does it hurt bad enough to wait in the waiting room once you get there for another hour and a half or more? And so what ends up happening is that a lot of people don't go to seek healthcare in the first place, right? They just suffer in silence because that's the West Virginian tough bootstrap thing to do. The further and further away and the less accessible these facilities become to regular everyday Americans, the more that culture of suffering and silence is going to pervade. People are going to die younger, they're going to get sick younger, and their overall quality of life and ability to work and earn a living is going to suffer as a result. I know for me, as a 29-year-old woman who is lucky and deeply in love with my boyfriend, we want to get married one day and possibly have a family. That's a really big deciding factor for me. Do I want to risk getting pregnant in a state where reproductive health care is so dangerous and tenuous and risk the now 40 minutes, soon to be hour and a half long drive to the closest hospital if something does go wrong or when I eventually might need to deliver the child? That's going to factor in heavily to whether or not we decide to grow our family in West Virginia, whether or not I can afford to continue to live in the state that I love so deeply. Because at the end of the day, it's going to come down to the pennies, right? And how bad does it hurt? I hope that answered your question.
Thank you so much.
Bonamici.
I really appreciate it. And I wanted to ask you, I'm from Oregon, Dr. Pulliam, welcome. And in our state, in large part because of longtime leadership in our state legislature, about 97% of Oregonians do have health insurance right now. But like Representative Kelly, I represent a district that has urban, suburban, and rural. In fact, I was just at a ribbon cutting of a community health center out in rural Tillamook County over the weekend. They're extremely concerned about possible cuts. In Oregon, the average increase in premiums for people will be more than $1,000 if the tax credit bill is not remedied, and that's what we're here to fight for. But what I wanted to ask, and if each of you could respond briefly to this, sometimes people say, well, the Medicaid cuts don't affect me because I'm not on Medicaid. So can you talk about what it means to everyone if these cuts go through, if the Medicaid cuts go through, if the premiums go up, what does that mean to everyone in Oregon or in your state? So I want to get the message out there that this doesn't just affect people on Medicaid. Thank you.
Lee, do you have a question?
I'm happy to start and just to say, Medicaid has become so important. It's important to our states. It's certainly important for the people that rely on it, but it's also important for our healthcare providers. And what we're hearing is just how much a lot of the healthcare system was already taxed. Medicaid was helping a great deal. Most of the rural hospitals in this country get a lot of their revenue from Medicare and Medicaid. And so the cuts to the program, whether it's fewer people being enrolled or whether it's states not being able to spend as much money, means that some of these facilities will not be able to stay open. And a lot of our country, already people have to travel for a distance to get their care. And so we're already seeing that hospitals are saying, hey, in 2 years, my revenue is going to go down. And that's why we're already seeing and hearing reports of provider systems not going ahead and investing in expansion, closing their doors, certain parts of their programs like labor and delivery, or closing their doors altogether.
We just had a labor and delivery unit close in Seaside Hospital, which is on the coast in a pretty rural area. And the question is, well, where do you go now? Dr. Pulliam?
Yeah, so, I can speak to this as an emergency physician, and it's not unique to any one hospital. Waiting rooms are full. Patients wait hours, sometimes 6, 8 hours to be seen in our ERs nationwide. Um, and if we are the only place that people can turn to get even the most basic care, we are thrilled to be able to care for them. But also, there are only so many doctors, there are only so many nurses, and those wait times are going to go up. Patients who are legitimately sick will be in the waiting room hoping that someone gets discharged or a bed becomes available. To speak to, clinic closures, we have a large population of Medicaid patients in our valley in Southern Oregon where I work. And clinics rely on those patients to keep their doors open and keep the lights on. And if those patients can't afford care even when they need it, those clinics will have less patients, not be able to sustain their operations and close. And so even patients who did have private insurance or are millionaires aren't going to be able to get into specialty care that they need,
Right.
because all of us are funding the healthcare system. We all need healthcare. It is a universal need. And clinics are there to care for everyone and expect to care for everyone.
Thank you. Ms. Plant, did you want to add anything to that?
I think that Dr. Pulliam really hit the nail on the head, and it's important that we all recognize that these cuts aren't going to trickle and affect everybody. It's like a tsunami. It's going to hurt really, really, really bad. Because if you go to a healthcare facility that accepts Medicaid, period, Medicaid helps your healthcare, because the doors aren't just going to close for people. They're not just going to close for the uninsured. They're not just going to close for people on Medicaid. They're going to close for all of us. And no matter how much you have in your bank account or how fat your wallet is, when you drive up to Welch Community Hospital and the doors are locked and the lights are off, you're up a creek. Literally, it's up a creek.
Okay.
Thank
so
you. I yield back.
Thank you. And we'll just ask members to stick to one question, please. Representative Beatty.
Thank you. I'm from Ohio, and while I don't have a lot of farms, I have a lot of small municipalities that would be what I'm going to call rural-like. And then I have a lot of suburban and inner city. And so I think it all works the same. But I want to piggyback on my one question off of Congresswoman Bonamici in a more direct way. You've all answered it or stated to it, but we get a lot of people who think that there are Medicaid nurses. And I need you to tell me that that's not true, and Medicaid doctors. And to your point, Mariah, they then think it doesn't affect me because that's the Medicaid part. And I think it's very important for America to hear what this Republican administration is doing, is giving us false information or leading us to believe false. So if each one of you on the record in the mic could say that, and you've kind of touched on it, that there are not Medicaid nurses or assistants or doctors. Matter of fact, with the law, they don't even know when people are coming in what their billing is. But I think that is so important because people have said, oh, it won't affect me. I'm not on Medicaid. And I can see a nurse or a doctor. Thank you.
So yeah, as an ER doctor, again, I get to see anyone who walks through the door, regardless of what their insurance is, or even if they don't have insurance. I'm a doctor for everyone, but Medicaid helps fund our emergency department. It pays for techs, it pays for doctors, it pays for nurses, along with your private insurance. We are not one or the other, all or nothing. We are everyone.
The answer. Representative Horsford.
Thank you, Mariah. It's Thank you for centering the voices of real people and your brother, Matt. It's a blessing, I'm sure, that you are in his life and that you're providing him the care and attention that he needs. I wanted to ask you, as a small business owner, we're dealing with a lot of policies that are creating a lot of economic uncertainty for small businesses. So can you talk about how difficult it is to start a business to begin with, and um, particularly as it pertains to healthcare cost, how these enhanced premium tax credits have allowed you to have the coverage as a small business owner, and what does that impact to other business owners if that goes away or is not available to you?
And thank you for that question. So for me, as a small business owner, which has been my dream my whole life, is to run an arts educational program for teens and tweens in Appalachia. And that's what I get to do for a living, is play pretend. It's so much fun. But we are currently experiencing a time where parents can no longer afford to send their kids to extracurricular activities that cost money. They can't afford to contribute towards costumes and sets. And so I'm seeing it on one side of my direct income is being hit by people not being able to access these little extras because the economy is already hitting them so hard. But then also from the other side of it, as a person who needs healthcare, who needs to be able to take my medication and get my glasses and all that good stuff, um, $388 is the difference between, like I said, 2 car payments. It's the difference between whether or not I can afford to pay my insurance for my business. It's the difference between whether or not I can afford to buy supplies. And it's making me ask that same question about the threshold. How bad does it hurt? Does it hurt bad enough to sacrifice this part of my budget in order to go and get care? And for me, I can say that if the EPTC goes away, I simply will go without. I will not have health insurance, and I will not go to the doctor because I can't afford to. So this really is a life or death situation for myself and for so many other people who are young and bright and inspired and want to contribute to our society and be successful. But it really feels like there are chains dragging us down, and that our state, our country, our government is not rooting for the small business owner, for the middle class American. And that's really where I'm feeling it, is on both sides of my income and also the healthcare piece.
Mark.
Thank you so much. I just want to thank you, Mariah, Dr. Pulliam, for really just putting the human face on this and what this fight is about. And that's why we're in this fight. And thank you for sharing the story of your brother. It's those stories of how families come together and provide for the ones they love, and how these tax credits, Medicaid, all work together to give people a solid floor so they can have no ceiling on the success and the ability to care for their families and to build a business. And we're just really grateful for that. That's our motivation for this fight. It is our motivation why we are imploring Republicans to end this shutdown, come to the negotiating table. But Republicans are trying to define this as something else. So I am hoping that you, Chiquita, can clarify for us. Isn't it true that under federal law, only citizens or legal residents are able to obtain coverage under Medicare, Medicaid, and the ACA?
Yes, the law is quite clear that to be enrolled in Medicare, Medicaid, and the Affordable Care Act, you are either an American citizen or you are a legal immigrant. And the idea that this is anything other than fighting for the American people, the millions of hard-working Americans, is just completely false.
Thank you. I yield back.
Thank you so much. Thank you, Whip Clark. And thank you all for your testimony today. I know it's not easy to step forward like this, but it's incredibly helpful and important for us to hear your firsthand accounts and stories. And it's clear that America faces a healthcare crisis that we must solve immediately. This is a right now problem for millions of Americans. Co-pays, premiums, and deductibles will skyrocket, and millions will soon be priced out of any coverage at all. And that drives up costs for everyone. House Republicans are AWOL. They need to end their paid vacations and negotiate with Democrats on a spending bill that avoids this GOP healthcare crisis. Ignoring a crisis that guts healthcare for tens of millions of Americans is unacceptable. And canceling 2 weeks of votes isn't a negotiation, it's an abdication. We need an honest dialogue to find real solutions. But GOP lies about immigrants getting tax credits and Medicaid just pollutes our prospects to solve this crisis. Every reputable journalist who looks at this fraudulent claim determined that it is a pants-on-fire lie. What is true is 20 million Americans face massive price spikes on their healthcare bills, with premiums doubling. What's also indisputable is Republicans' historic Medicaid cuts, which will already result in 15 million Americans losing healthcare. Those are real, verified facts. So let's start there and bury Republicans' immigrant-bashing lies and have a real debate and negotiation. Let's watch this video to break it down.
They would rather give taxpayer-funded benefits to illegal aliens.
That's just not true. Fact. Undocumented immigrants can't get federal health care programs, no comprehensive Medicaid, no ACA subsidies. Here's another fact. Republicans are trying to take health care away from 15 million Americans and raise health care premiums for millions more. Healthcare costs are rising because Republicans want to give tax breaks to their billionaire friends, not because of immigrants. Stop the lies. Protect healthcare for all Americans.
Well, thank you. As we come to a close of this portion of the hearing, I want to thank our witnesses, the Honorable Brooks LaSure, Ms. Mariah Plante, and Dr. Pulliam, for your expertise, for uplifting how these healthcare cuts harm our communities. Your stories and your testimony is so, so powerful. How Democrats will not healthcare for all Americans. And with that, we will now transition to the second panel of this hearing. We will hear from members on how their constituents are impacted by this Republican healthcare crisis. We are starting with panel number one, Representative Rob Menendez, Representative Greg Stanton, and Representative Mike Johnson. On policy, and now we're with panel number one. We have three members that are here to testify. We will start by seniority over here. I'll start with you, Representative Mike Thompson.
Thank you very much. Thank you for holding this hearing. and shining a light on this very serious issue facing all of our constituents. Over this past week, House Republicans have literally gone on vacation while millions of Americans are facing an unprecedented healthcare crisis. The Affordable Care Act premium tax credits that help millions of hardworking Americans afford their insurance are set to expire. Because Speaker Johnson refuses to hold votes, Americans, our constituents, will suffer. In my district, the numbers are pretty staggering. A family of four making $129,000 a year will pay $14,444 more for their health care, a 161% increase. A 60-year-old couple making $82,000 a year will pay $23,788 more, a 526% increase. Who in the hell can afford to pay that type of money for insurance? It is obscene what they are doing, what the Republicans are doing. Nationally, the picture is just as bad. More than 24 million Americans will either face higher costs or lose their coverage altogether, including 1,600,000 children, 3,300,000 small business owners. And remember, when we did the Affordable Care Act, a big part of the justification and why it was so supported so strongly is because it allowed small business owners, self-employed individuals, to finally get health care coverage. And you know, the irony is more than half of the Americans affected live in Republican congressional districts. Even our Republican colleagues are sounding the alarm. I never thought you'd hear me say I agree with something that Marjorie Taylor Greene said, but I do. And I quote, "My own adult children's insurance premiums are going to double, and not a single Republican in leadership has given us a plan," end of quote. At the same time, Medicare telehealth coverage has lapsed. Doctors across the country are canceling appointments. One woman who called my office said that without a telehealth option, she can't afford to get her care because she lives so far away. The Uber bill is $100 each way. There's bipartisan support to fix this, but the Republican leadership won't call their membership back, and they won't allow a vote on the floor. And let's remember, by federal law, undocumented immigrants, notwithstanding all the malarkey we're hearing, are not eligible for federally funded health care. Congressional Republicans know this, but they're spreading disinformation. Madam Chair, they're lying. They're lying to distract from their inaction. Democrats are here, ready to protect Americans' health care. It's time Republicans come back to work. Again, thank you for holding this hearing. It's extremely important for my constituents, as I know it is for yours. I yield back.
Well, thank you, Mr. Thompson. I now recognize the gentleman from Arizona, Representative Greg Stanton.
Chairmember Barragan and the other members of Steering and Policy. This is an important hearing. We're on day 8 of a government shutdown, all because Donald Trump and the congressional Republicans would rather shut down the government than work with Democrats to do the right thing, to protect Americans' health care. After canceled votes again, I spent the last few days in Arizona meeting with people who will pay the price if Congress lets the health care tax credits die. Monday, I sat down with small business owners. One of them was a young entrepreneur who runs a thriving salon in Phoenix. She pays $280 a month for ACA coverage, steep but manageable. That insurance lets her get the care she needs to keep working. Without these tax credits, she will lose her business. Her exact words, quote, "Let me keep doing what I love without sacrificing my health to do it." Another entrepreneur from Chandler wrote to my office terrified. After medication, bills, and rent, she has $200 left each month for groceries and everything else. That's on a good month. She ended her letter to my office with this, quote, "I'm begging you with all my heart not to give in no matter how long it takes." This is not a political game. These are real people facing impossible choices. groceries or health care, a roof over their heads or treatment for their children. Their dream of owning a small business or peace of mind that if they get sick, they won't go bankrupt. None of us want to shut down. We hate the shutdown. It hurts federal workers, thousands of them in Arizona, and everyone who depends on them. But I can't look at myself in the mirror if I abandon my constituents who are barely hanging on. If these tax credits expire, the average Arizona pays almost $800 more out of pocket. Families, thousands more. That's a luxury price tag on something that should be affordable. People don't stop getting sick when they lose insurance. They stop seeing doctors. They skip preventative care. They cancel appointments. Then, when something treatable becomes critical, they flood emergency rooms, overwhelming our healthcare system. A Phoenix doctor told me this week, quote, reducing access to preventative care dramatically delays and increases the cost of care. When people finally do come into the doctor's office, it's because of a really dangerous situation. This is a manufactured crisis by congressional Republicans, and it has a simple solution. Extend the tax credits. House Democrats, we're here. We're ready. We can fix this crisis today. Republican, my friends on the other side of the aisle, come back to the table, extend these critical ACA subsidies, end this shutdown. That's exactly what the American people want, they deserve, and they need. I yield back.
Well, thank you, Mr. Stanton. I now recognize the gentleman from New Jersey, Mr. Menendez.
Thank you, Chairwoman. Thank you to my colleagues on the committee for giving me the opportunity to speak today. Let's be clear about where we stand. This shutdown is no accident. It's a direct result of the Republican healthcare crisis and the broader effort to roll back the Affordable Care Act and to make healthcare more expensive for all Americans. This week, I visited the North Hudson Community Action Corporation, a cornerstone of our community and one of New Jersey's largest federally qualified health centers. North Hudson Community Action operates 10 health centers, 4 Head Start and Early Start facilities, and 2 social services offices. They accommodate over 268,000 patient visits every year. Families, workers, and seniors who rely on them for everything from medical and dental care to behavioral health and early childhood education. They employ more than 750 dedicated, hardworking staff, people who have devoted their lives to helping others. But what I heard during my visit was deeply concerning and a reminder of the real-world consequences that Republicans' actions have on all of our communities. Their team told me how the uncertainty caused by the Republican-led government shutdown is threatening the very programs that our neighbors rely on, programs like WIC, Head Start, and public health. These are lifelines for working families in Hudson, Bergen, and Passaic counties, and yet Republicans are using them as bargaining chips in a political game. Republicans' health care plan will devastate access and affordability for people who rely on North Hudson Community Action and organizations like it. And unless we act soon to extend ACA tax credits, premiums are set to rise drastically for families across the country. A family of 4 in my district making $64,000 per year will see their annual premiums more than triple. That is completely unacceptable. That's why House Democrats will continue to hold the line, fighting to expand healthcare access, lower costs, and fund the government responsibly. We believe that federally qualified health centers like North Hudson Community Action deserve stable funding so they can continue doing the life-changing work that they are committed to doing every single day. I told the team at North Hudson Community Action that I would carry their message back to Washington, and I am thankful for the opportunity to do so today. But more than that, their team and the thousands who rely on them are counting on us to take action. This fight is too important, and we are in it together. Thank you, and I yield back.
I want to thank our first panel for your testimony. Hearing about your constituents is a testament of this being a problem across the country in every district. If we had Republicans here today, maybe they would share some of their stories. At some point, we'll hear from constituents, hopefully across this country. And with that, we will move to the second panel of members. We have Representative Glenn Ivey, Representative Suzanne Bonamici, and I see Representative Deborah Ross is here. We will have Representative Ross. Okay, we will start with Representative Suzanne Bonamici.
To the Steering and Policy Committee for holding this important hearing to expose the Republicans' continued assault on Americans and their pocketbooks by making devastating healthcare cuts and driving up the cost of health insurance significantly. Republicans' cruel budget, the big ugly bill, will decimate Medicaid to pay for tax cuts for billionaires. And now they're continuing their heartless obsession with destroying the Affordable Care Act. These Republican policies are putting rural hospitals and clinics at risk of closure, which hospitals and health systems in my state of Oregon described as catastrophic. Last weekend, I joined a celebration for the newly opened Nehalem Bay Health Center and Pharmacy. It's in a rural coastal town in the district I'm honored to represent. The center is replacing an older clinic and doubling the capacity of the patients who can be served. Hundreds of people showed up in support. And these rural clinics are critical. Without clinics like Nehalem Bay, people are forced to travel for hours, sometimes on dangerous roads at night, to seek the care they need if they can find another provider. And the Republican assaults on our healthcare system put rural clinics like Nehalem Bay and others and the patients they serve at risk. These cuts to healthcare and the Republican shutdown more broadly are emblematic of the first 9 months of the Trump administration, causing constant chaos and inflicting incredible harm to people and families. Too many Oregonians and Americans already struggle to afford health care. I will not be complicit in the Republicans' plan to kick millions more off of their insurance, or if they get their insurance through the ACA, to make their costs skyrocket. In my district, a family of 4 earning $64,000 a year would see their premiums rise 275%. This is unacceptable for families who are already counting every dollar to afford necessities. This past weekend, I held 2 town hall meetings, something most Republicans still refuse to do. And I heard that many of my constituents are extremely worried about the already high cost of living and how these Republican healthcare cuts will further harm them and their families. My constituent has a son who's an adult with developmental disabilities. And because of Medicare and Medicaid, his son is able to live independently. Cuts and reductions threaten that independence. You know, Donald Trump said he was going to lower costs, but his chaotic policies are making costs rise, not fall. People across the country are struggling to pay for housing, groceries, and childcare. And if healthcare premiums skyrocket, they will reach their breaking point. Oregonians and Americans are desperately trying to understand why Republicans are choosing to fund tax cuts for billionaires and halt essential government programs rather than helping hardworking people who are already struggling to get the care they need. Democrats in Congress are fighting to protect health care and are imploring our Republican colleagues to join us in ending their shutdown and in ending this impending and preventable further healthcare crisis. The American people deserve better than they're getting from this administration, and these recent attacks on healthcare are yet another example of why. Thank you very much. I yield back.
Thank you, Representative Bonamici. I now recognize Representative Deborah Ross.
Thank you very much, Madam Chair and members of the Steering and Policy Committee, for holding this important hearing where you can hear about what is happening around the country to people's health care. I'm proud to stand with my colleagues today and speak about the dangerous and deliberate choices that brought us to this point. The Republican-led shutdown is not over policy disagreements. It is the direct result of the extreme agenda that treats access to health care as expendable and views the well-being of working families as a bargaining chip. At the center of this crisis is the GOP's refusal to extend enhanced premium tax credits, which have helped millions of Americans afford coverage on the ACA marketplaces. These tax credits have kept families afloat in the face of rising costs and economic uncertainty.
In my home state of North Carolina, nearly 900,000 people have seen that keeps Zoe thriving and out of the hospital. Leah Carlton, a resident of a rural mountain community in western North Carolina, suffered multiple strokes and lives with ongoing complications. Without the enhanced premium tax credits, her insurance costs will skyrocket to nearly $30,000 a year. And she told me plainly, without this coverage, she may not have survived. Furthermore, she may not have made it to the hospital at all, for the rural facility that treated her is now at risk of closing under Republican efforts to cut federal Medicaid funding for rural hospitals. North Carolina has made extremely effective use of federal healthcare dollars. Our long overdue Medicaid expansion has helped fund and stabilize rural hospitals, expand access to behavioral health and substance abuse disorder treatment, and integrate whole person care through programs like Healthy Opportunity Pilots, which address social drivers of health such as housing, nutrition, and transportation. That progress now hangs in the balance. If the enhanced premium tax credits are allowed to expire and the deep cuts to Medicaid take effect, the impact on our state will be catastrophic. On my way here, I was on the plane with a Republican state senator who has come to Washington, D.C. to talk about the effects on Medicaid and ask for federal government assistance. He may not be talking to the House members from his party, but he sure talked to me, and I hope he talks to our senators. Instead of acting to preserve programs that have been transformative to millions of American families, House Republicans are walking away. They let the clock tick down and refuse to guarantee credits remain in place, leaving families in limbo, insurers in flux, and state exchanges unable to provide certainty for the next cycle. And this isn't occurring in isolation. It's part of a much broader pattern where my Republican colleagues choose to harm the welfare of working Americans in order to reward the wealthiest among us, cutting essential programs and weaponizing federal agencies that sow divisions. The big ugly law, which slashes more than $1 trillion from Medicaid and makes it harder for people to enroll in Medicare and CHIP, will leave millions of Americans uninsured. And that's not just a budget. It's a blueprint for decimating America's healthcare system. The shutdown the Republicans engineered is accelerating the very crisis they created. And it must stop. Families across the country are watching their premiums spike, some hundreds of dollars a month, because House Republicans are holding these tax credits hostage. It's cruelty masquerading as fiscal responsibility. So I urge my Republican colleagues to get back to work. End this shutdown, extend the tax credits, reverse the cruelest cuts in H.R. 1. Families in North Carolina and across the country are watching and waiting. Thank you, and I yield back.
Thank you, Representative Ross, for sharing the stories of Shannon, Zoe, and Leah, and so many others. With that, I recognize the gentleman, Mr. Ivy.
Thank you, Madam Chair, and I want to thank the committee for hosting this hearing. I think this is super timely for sure, particularly for my community. We're in the middle of the government shutdown. I have tens of thousands of government employees who are suffering from that, but they understand that the healthcare crisis is critical, and they're strongly in support of us linking those two together because the Republicans have dug such a deep and dangerous hole with respect to healthcare coverage across the country, and they understand that. They know that the $1 trillion in Medicaid cuts is going to have a devastating impact on many Americans, not just in Prince George's County and not just in Maryland, but across the country. And ripping away the ACA tax credits has been devastating as well. We have, just in my county, the impact of those two things combined together, for example, with respect to the premium increase, a 60-year-old couple is looking at $11,581 tax increase in 1 year. That's $1,000 per month. That's the type of premium work spike that these couples, these communities are facing. Family of four is looking at a 200% increase under the same issues. So it's critically important for us to make sure we maintain this fight and keep pushing forward to make sure we protect the rights for Americans to have basic access to health care. I did want to mention, too, I've been getting a lot of questions from people about where are the House Republicans? I do want to make sure the public understands that the game they played was to try and pass a bill that they knew would be DOA and arrival when it got to the Senate. And they left town quickly, in part so they wouldn't have to be here to try and fix what they'd done, but also so they wouldn't have to deal with the Epstein files, because they knew we were about to pick up number 218 and have enough people to get that passed so we could force them to move forward on that. And then they had the nerve to complain and say that, we don't have enough time to work something out on this healthcare issue, so let's just pass the clean bill. Forget that. For 7 months, starting from January 20th, we knew this day was coming, and they knew it was coming too. And when they passed the big ugly bill that contained the $1 trillion in tax and cuts to Medicaid, they knew the problem they were creating because we presented it to them. We fought them about it with amendments and the like in committee. And then with respect to the Affordable Care Act, refusal to extend those tax credits to protect the American people, they knew about that too. Deborah Wasserman Schultz there is on the committee with me on during the fight when we were trying to present amendments to try and change that, and they voted them down every time. I think it was 3 at least on a party line vote. So they knew it was coming. They moved forward with it anyway. Then they passed that bill that they knew was going to be a DOA. Then they ran from town, and now I don't know if they're in the witness protection program. I don't know where they are, but they need to come back. And the last point on this, and I'll turn it back over. People are asking about whether members of Congress should be paid right now, and I'll say this. The only federal government employees who should not be paid right now are House Republicans, because they're the only ones who are not here doing their job. They knew the mess they created. They left town and they're trying to stay away because they're afraid to come back and deal with the mess and try and fix it. So with that, I'll yield back, but I want to thank the committee again for the work that it's done on this and for putting this together.
Thank you so much to our member panelists. This panel is excused, and we'll next turn to Representative Sarah Jacobs, Representative Dave Min, and Representative Brad Sherman.
That they're offering us a clean CR. First of all, yes, it reads like clean CRs I've voted on and voted in favor before. But there are 2 issues. But they basically were sending a clean CR to a president with dirty hands.
So first, they refuse to put in a provision that prohibits clearly and with teeth impoundment of the funds that we send. And second, they refuse to put in a provision preventing rescission. So what does this mean? It means we're supposed to pass a continuing resolution to provide funds for all of the functions of government, including ones that they support far more than we do. And then the president is free to defund whatever priorities he doesn't want, or to send to the Congress a rescission of any provisions. So instead of us agreeing that we continue government funding at the same level, they've got two mechanisms to defund Democratic priorities while funding Republican priorities. We're told that they'll negotiate on health care just as soon as we pass their bill. They wouldn't negotiate on health care in January. They knew in February that these credits were going to be abolished and 22 million Americans were going to face massive increase in their premiums. They knew that in March when they wouldn't negotiate. They knew that in April when they wouldn't negotiate. And come July, they said, you know, not only won't we negotiate regarding the people who are going to lose their Obamacare subsidies that are necessary because otherwise their premiums double, we're going to take health care away from people on Medicaid. So they won't negotiate with us for all these months. Now we're supposed to give them what they want, and then they're going to negotiate? I don't think so. Fool me once, shame on me. Shame on you. Fool me twice, shame. Now, we have seen what happens when federal employees don't get paid. Burbank Airport lost air traffic controllers, a major airport close to my district. Massive delays. Why? Because some air traffic controllers decided to call in sick, as we're seeing that across the country. Now, the National Association of Air Traffic Controllers has urged their people to show up unless they are physically sick. But I have a difficult time telling people we're not paying you, but you show up for work. Now, why are we here? Why are we even talking about a continuing resolution? That's not the way to run government. There are 12 appropriations bills that should have passed the House of Representatives in the spring, maybe the early summer. And they should all have become law months before September 30th, because the people that run the government should have known months before their year began on October 1st what their budget was. Well, have Republicans who control both houses of Congress passed these 12 appropriations bills that function different parts of government? Not a single one. They haven't done their job, not in January, not in February, not in March, not in April and May. They have only 3 of those bills have passed the House, and none have passed, and of those 3, none were supported by the Senate. So why is Congress shut down? You know, the last time we had a major major shutdown, it was when Congress was not scheduled to be in session. It was Christmas. But the time before that, Congress was open. We have to be open. If any federal employee is essential, Congress is essential because we're the only ones that can open the government back up. So what we were doing in 2013 when we had a shutdown, we had hearings on FEMA. I represent the Palisades. Those were important hearings. We had hearings scheduled today before Judiciary to deal with the Epstein files. No wonder Congress is shut down. We can't open up the government till we bring Congress back into session. Now, there is an issue where Democrats are divided. Some believe that all Republicans have been sent home because maybe some of them would talk to us about health care, and their leadership doesn't want to do anything on health care. Another chunk
of Democrats believe that they sent everybody home so that we wouldn't talk about the Epstein files and we wouldn't swear in Ms. Grijalva, who will then sign the discharge petition and force a vote on the Epstein files. I think both Democratic groups are right. They don't want to talk about health care, and they certainly don't want to talk about Epstein. So Democrats need to fight for those millions who are losing their health care, including, and I have the statistics for California, but I've gone on too long, and I bet you my colleagues from California will bring those statistics up. But millions of Californians are losing their health care because Republicans wouldn't negotiate in January. They wouldn't negotiate in the spring, and they won't negotiate now.
Thank you. Thank you, Representative Sherman. Members are reminded that each panel has an allotment of 10 minutes total. So if you could keep your remarks brief, that would be helpful. And Representative Jacobs of California, you're recognized.
Well, thank you. And I'm honored to be on this esteemed panel of Southern Californians. Thank you to the Steering and Policy Committee for convening this hearing today. One thing I think we need to be clear about is that the Republican shutdown didn't actually begin on October 1st. It began on January 20th. Since he took office, Donald Trump has been shutting down our government and stealing power through DOGE, mass firings of federal workers, slashing federal programs and departments, ignoring Congress's constitutional role, disregarding court orders, deploying the military on American soil against Americans, and so much more. So we should all be clear that whether or not we are in a technical government shutdown, it doesn't change Trump's calculus. It's not going to sway him if he wants to break the law and fire people or illegally deploy our troops on American soil, because he did it before. That's why this isn't business as usual. It's why there's no such thing as a clean state, and it's why we need concrete guarantees that this administration will respect checks and balances, recognize Congress's power of the purse, and protect Americans' health care. So here are the facts. Republicans control the House, the Senate, and the White House. If Republicans want any Democratic votes, they know what it will take to earn them. We've told them. So they need to show up to work, they need to talk to us, and they really need to come to the table. So here's what Democrats are fighting for. We want to reverse Republicans' devastating Medicaid cuts that kick millions of people off their health care. Over the past several months, I've met many constituents who are the collateral damage of these cuts. I met 5-year-old Delilah Knight at Rady's Children's Hospital. She is possibly the happiest kid I've ever met. You wouldn't know that she has 28 different diagnosed medical conditions and about 6 medical appointments per month because she's constantly singing and laughing and dancing. I met 2-year-old Caesar, who has short gut syndrome, retinal detachment in his left eye, and hearing loss. He has between 20 and 30 medical appointments per year that Medicaid helps coordinate and cover. I also met Marie at San Ysidro Health Clinic in El Cajon, who's getting help with her diabetes thanks to Medicaid. And I met Jesse, who got hurt on the job, and Medicaid was the only reason he was able to get the rehabilitation he needed so that he could go back to work. These are the Americans we're fighting for. We're also fighting to extend life-saving ACA premium tax credits, because if they expire at the end of the year, most people will see their premiums double, if not more. In my district, a 60-year-old couple that makes $82,000 a year will see their premiums go up by $15,000. $15,000! That's crazy. That means more people won't be able to get their chemo, their heart medication, their insulin. Increases like that mean millions of people will be priced out of their health insurance. And on top of that, hospitals and community health centers will see more uncompensated care because instead of getting regular checkups that are cheaper and preventative, people will have to go to the ER when it's life-threatening and expensive. This shifts financial pressure onto hospitals, local governments, and insured patients through higher premiums and hospital bills for the rest of us. And lastly, we're fighting for any deal that we negotiate to actually be honored. Much to Donald Trump's dismay, we have 3 co-equal branches of government in this country. And per the Constitution, Congress has the power of the purse. The president needs to respect that whether he likes it or not, and he can't just decide when to disperse funds on a whim. None of us takes the shutdown lightly, especially not me. I represent San Diego, the biggest military community in the country, which is home to 47,000 federal workers. These federal workers, from air traffic controllers to TSA agents to researchers, are either furloughed or working without pay. Our service members are working without pay too, making it even harder for our military families to make ends meet when they already struggle to afford housing, childcare, and put food on the table. 45,000 service members and military families already visit the San Diego Food Bank every single month, and that's when we're not in a government shutdown. It's not a guess or a prediction that that number will go up. American families are at a breaking point, on the edge of not being able to afford healthcare or access federal programs they rely on because Donald Trump is hell-bent on taking them away. That's why we're here. We're not going away, and we're going to keep fighting to protect Americans' healthcare and make sure our government actually works and delivers for people. Thank you. I yield.
Thank you, Thank you very much, Congresswoman Jacobs. Congressman Dave Min from California as well.
Thank you so much, Madam Chair and members of the DSPC for holding this important hearing today. I am a freshman, just got elected in one of the closest races in the country last year. Before coming into politics, I was a law professor, and I've just been shocked by the lawlessness we have seen this year, whether it is deploying troops in our streets, whether it is the assault and kidnapping we see on a daily basis from ICE agents, whether it is the illegal cuts to appropriations made by Congress, and on and on and on. I've watched stunned this year as this Congress has refused repeatedly to stand up for our Article 1 constitutional authorities. And in fact, as we have over and over again greenlit ex post facto the illegal actions that Donald Trump and his administration have undertaken. And we are here right now in a shutdown. We are out for 3 weeks. And this seems to me to be a continuation of this pattern of condoning lawlessness from this particular feckless Congress. I've sat here for 9 months and not once been lobbied as a swing member to vote for any of these Republican bills. They have rammed through some of the most extreme, no, not some of the most extreme radical agenda, lawless agenda in history. And not once have they asked for votes from me or my fellow swing seat members. And now they're trying to blame this on Democrats. This is Donald Trump's Congress. This is Donald Trump's administration. This is Donald Trump's shutdown. And it is unfortunately having massive negative impacts on the constituents I represent. And let's be clear what this particular issue is about. This shut is going to also other things. Lead issues about this shut is going to also other things. Lead to 15 million Americans lose. After that, Medicaid, the $1 trillion in cuts to Medicaid, potentially another $500 billion extreme policies. And that is what Democrats are standing up for right now. In home district in Orange County, which is a relatively wealthy tens of thousands are going to lose their health care. And people don't do something about that. Not abstract cuts we're talking about. They're cuts that will harm real people. She works insurance, single bins across the country cannot. These are people who we're talking about who will die, and retirees and rural residents across the country. Then we'll see higher individuals for 50,000 and increases on average for 75% or more. or even quadruple. I will just tell you, I want to see us stand up right now. They want to see us of the administration, Congress that refuses to act to hold Donald Trump in check. I recently had a chance to meet with my air traffic controllers, and while they are going to work right now, and they're being encouraged to do so by their union, they also are going without pay. Their families are struggling. They don't know how long this shutdown is going to last. And I'll just say that they told me specifically, we need you to stand up and fight. The stakes of this are much more important than us losing pay for a couple weeks. We need you to stand up and fight back. And it's not lost on me as a member of the Oversight Committee that this 3 week of us not being in session, of Republicans not being here, of Mike Johnson closing off the House floor, of not seating Adelita Grijalva, the ICE raids, the troops in our streets, they are all grossly unprecedented. Many of these actions are grossly illegal, but they're also effectively a way to distract from the fact that this administration also is engaged in a massive cover-up of the Epstein files, that they refuse to produce these, that Donald Trump has called these a hoax. As someone who sits on the Oversight Committee, who's talked with the survivors of some of the survivors of the Epstein child sex trafficking ring, let me tell you, this is not a hoax. There are documents out there that we need access to that I think will expose a lot of light onto the breadth and scale of this operation. We demand justice for the survivors, transparency for the American people, and that is also part of why we need to stand up right now, because people deserve transparency and justice. And with that, I yield back.
Thank you so much to our panelists. And as they make their transition, we'll ask Congressman Jamie Raskin of Maryland, Congresswoman Emily Randall of Washington, and Congresswoman Kelly Morrison of Minnesota to make their way to the witness table. And Congressman Raskin, as you hustle to your seat, you are first.
Thank you, Madam Chair, and thanks to the committee for doing this. If your name's on the ballot, your face should not be on the milk carton. And all we say to our Republican colleagues is show up for work like the rest of America does, because we need you here negotiating an end to this healthcare debacle the Republicans have imposed on the country. I've got 23,000 constituents who receive ACA tax credits that are about to go up dramatically, in most cases double or even triple. A 60-year-old couple in my district earning $82,800 a year are about to see a premium hike of 168% or $11,581. How many people can afford to pay an extra $11,000 a year for their health insurance premiums simply because the Republicans want to shut down the government and throw millions of Americans off of their health care? That doesn't make any sense. I just want to tell you about a couple people in my district, concretely what all this means to them. I have a constituent, Cheryl, who's an occupational therapist, and she directs a wonderful boxing exercise program for people who suffer from Parkinson's disease. It's called Rock Steady Boxing in Rockville, Maryland. And so this is an evidence-based program that helps people stay healthy, strong, and independent. If her health insurance costs go up on ACA, Cheryl likely will not be able to continue to serve this community of people suffering from Parkinson's disease. And she says that we've created a supportive community to reduce isolation and depression among those living with Parkinson's and the people that support them. This is the fastest growing neurological disease in the country. If prices for the ACA go up 75%, I will have to make some very hard decisions. Please, please, please hold the line and encourage those around you to continue fighting for the health care of the people. Here's another one from a constituent of mine in Gaithersburg, Maryland. She says, as a participant in the ACA, we pay $24,000 a year for health and dental insurance for our family of four. We will not be able to afford insurance for our family if you do not hold the line on the issue of Medicaid and ACA tax incentives. Now is the time for political courage, she writes. Please do not compromise with fascists or those who seek to erode our freedoms. I am counting on you to defend our democracy and uphold your oath to the Constitution. So this is, we're in the fight of our lives here. This is a critical moment for American democracy. We don't have national health care the way that Canada does or most of the advanced civilized industrial countries do. But we've been able to patch together a system that's working for a lot of people, and they want to pull the plug on health care for millions of people. And we've got to hang tough and stand strong. So thank you for doing this, and I'm happy to yield back, Madam Chair.
Raskin, and now I don't know between the two freshmen that are on this panel. I don't. You can choose, but we'll go with
We can go by their birthdays, maybe.
Congresswoman Randall of Washington State.
Thank you so much, Madam Chair, for convening this space for us to hear about the impacts on our neighbors. It's clear that we are here doing the work. We're here ready to do our jobs, ready to negotiate, to work with colleagues from across the country and across the aisle to reopen government and serve our neighbors. But for the second week in a row, Speaker Johnson and Republicans have canceled votes to remain on vacation while American families are facing an unprecedented healthcare crisis. Instead of working across the aisle to lower costs for families in our communities, President Trump and Republican leaders chose to shut down the government. And I say chose because it is an active choice. They had months, as you have heard from panelists, thanks to the ACA's premium tax credits, she can afford this healthcare coverage. She's a small business owner, an independent provider, and she buys her healthcare on the ACA. But losing this benefit would push her insurance costs to nearly $3,000 a month. And the average mental health care provider makes about $60,000 a year, so $3,000 a month is solidly more than half of her take-home pay, leaving her just an average of $2,000 a month to pay for rent, to pay for food, to pay for all her other necessities. Other constituents with stories like these said, I wasn't able to afford health insurance until the tax credits. Please do not take this away. One of my neighbors said, I will either die from working too many hours to afford my health care, or I will die from heart disease. And another, without the enhanced premium tax credits, I wouldn't be able to afford my HIV treatment. These subsidies are literally keeping me alive. These stories make it clear that we cannot let political games put lives at risk. It's time for Republicans to come to the negotiating table and work with Democrats to open the government and protect these ACA subsidies that keep our community alive and healthy. Thank you. Do I turn it off or not? I don't know.
Kendall? Sorry, we're doing musical chairs up here with members coming and going. Congresswoman Morrison from Minnesota.
Thank you, Madam Chair, and thank you for holding this hearing and for giving the people of Minnesota's 3rd District the opportunity to participate, 3rd District that I proudly represent. Prior to my service later, I had the privilege of caring for patients as an OBGYN for more than 20 years. And I can tell you as a physician, I am truly afraid for my patients and for my colleagues to take care of them. The Republican policies of gutting Medicaid and now threatening to not extend the ACA premium tax credits that have made it possible for millions of Americans to access health care will cause tens of millions of Americans to lose their health insurance. Such a drastic increase in uninsured Americans will have dire consequences for clinics and hospitals already struggling to stay above water. In Minnesota, we are proud to offer the kind of care that people travel from neighboring states multiple hours, and in some cases, hundreds of miles to access. It's the kind of care the community, the state, and quite frankly, the Midwest region of the United States simply cannot afford to lose. But Republicans have put the desperately needed care these facilities provide in serious danger. A salient example in Minnesota is HCMC, a safety net hospital, level 1 trauma center, and a lifeline for the upper Midwest that runs the busiest emergency room in the state of Minnesota and trains the physicians we count on in moments of crisis, the literal future of our physician workforce. And I might add, the hospital that took care of many of the children who were shot in the Annunciation Catholic school shooting. It's safety net hospitals like HCMC that are strained even further under the circumstances Republicans have manufactured. Facilities will be forced to choose what service lines they have to cut, what workers must be let go, what patients will be forced to go elsewhere for care that will no longer be available. Failing to extend ACA premium tax credits and allowing devastating Medicaid cuts means those patients and patients of hundreds of physicians in this country will suffer because Republicans refuse to act. When a person or a family is without health insurance, it hurts their health in the short and the long term. You delay care. You postpone your appointments. You wait until you need emergency care. You give up the medications that were helping to keep your chronic condition from becoming life-threatening. Your child misses the vaccine that could have prevented a hospital stay, or worse. You miss the routine screening that could have caught the cancer early. Investments in preventative care save lives and save taxpayer dollars. Safety net hospitals and their workforces struggle when a community is made sicker by delays in care and growing numbers of people without coverage. Republicans are protecting billionaire tax cuts over the health of low and middle income families on the American taxpayers' dime and on the backs of healthcare workers across the country. And while all of that is more than enough reason to reverse that crisis, an analysis of the Republican health plan estimated over 50,000 preventable deaths as a direct result of the path Republicans have put us on. So Republicans are holding the government hostage at the expense of American lives. They've spent the last 8 months putting our vulnerable healthcare system on a fast track to disaster. They pushed almost $1 trillion in cuts to critical health programs, endangering countless clinics and hospitals, many in their own districts, to deliver tax cuts that benefit primarily billionaires. Now they're demanding we support a plan that will result in millions of Americans paying hundreds more a month for health insurance, thousands more in many cases to make the grim decision to live without coverage. Over half of the Americans at risk for the highest impact live in districts they represent. But my Republican colleagues are out of town with no urgency to act. It's unconscionable to me as a physician and should be absolutely disqualifying for the legislators failing to protect the health and well-being of the Americans they were elected to represent. With that, Madam Chair, I yield back.
To our panelists, thanks for coming to work today, unlike some of our friends who chose to not be here and get the people's work done. As we make a transition to the next panel will include Representative Jasmine Crockett of Texas, Representative Morgan McGarvey of Kentucky, and Representative Susan Delbany of Washington State. We're going to proceed in order of seniority. So Representative Del Bene, you are recognized.
Thank you, Madam Chair, and thank you to the committee for holding this important hearing. Let's just start with the facts from my home state in Washington. Nearly 200,000 individuals will lose Medicaid coverage because of the big ugly bill Republicans passed. 80,000 individuals will be priced out of ACA marketplace coverage without the extension of the premium tax credits. And for those that are able to keep their ACA coverage, they're going to see their premiums go up by an average of $1,300 a year. And that's the average. Older adults in my state between the ages of 55 and 64 are expected to see their marketplace premiums increase by over $1,900 next year. Trump promised to bring down prices, and he broke that promise. Groceries, healthcare, energy costs have all gotten more expensive. Trump's tariffs alone are costing the average family $2,300 this year. And if we don't extend these enhanced premium tax credits, families will be paying even more. Instead of lowering prices, Trump cut programs like Medicaid and SNAP, triggered $500 billion in cuts to Medicare, and increased the deficit by $4 trillion, all to give tax breaks to the wealthiest in our country. And now Trump and congressional Republicans won't come to the negotiating table to ensure that healthcare costs don't skyrocket next year. Democrats are here. We're right here. We're House Republicans. I've spoken about these issues numerous times, and I want to spend some of my time today making sure we hear from the folks that directly impacts. Here, right here, a collection of stories of people in Washington who are worried about losing their health care coverage without the extension of the tax credits. In here are stories of young professionals, parents, cancer survivors, business owners, and retirees who have coverage on the exchange so they can take care of themselves, their families, and their businesses. These are everyday Americans who just want to ensure they can go to the doctor next year if they need to. And it's not just those who get coverage through the ACA or Medicaid who should be worried. Our providers and health systems have been sounding the alarm. They know that these cost increases eventually are going to impact everyone. Cassie Sauer, the CEO of the Washington State Hospital Association, shared that, and I quote, "Choosing not to extend the enhanced premium tax credits will only make it harder to sustain local healthcare services. People who can't afford the increased premiums will still need healthcare. Hospitals will be left covering the cost of their care at a time when they are already struggling and bracing for the impact of the cuts imposed by H.R. 1, end quote. I've also been in contact with the Washington's State Insurance Commissioner, Patty Kuderer, and she said, quote, "Washington State has made tremendous progress in lowering our uninsured rate to 5%. The ACA marketplace is our most vulnerable market, where approximately 300,000 Washingtonians get their health insurance, and most receive a tax credit to help them afford coverage. Anything other than a straight extension will cause further delay and chaos in the market. I urge you to stop playing political games with people's healthcare and extend the enhanced premium tax credits as soon as possible," end quote. We are here fighting for our communities. We're Republicans. We need folks who are going to represent their communities, come to the table, and make sure we're protecting our healthcare. Thank you.
Thank you so much, Congresswoman Del Bene. Next, I'd recognize Congresswoman Jasmine Crockett of Texas.
Thank you so much, Madam Chair. They continue to say, trust us. These tax credits won't expire until December. Just trust us. We will negotiate. Well, I have news for our colleagues across the aisle. Trust must be earned. It is not given. You see, President Trump swore in on January 20th, and since then, congressional Republicans have perpetuated an economic war on Americans. They asked us to trust them on the price of eggs, yet they've made it harder for Americans to buy any and all groceries. They asked us to trust them when it came to the cost of housing, but it's become more difficult to pay your rent or mortgage. They asked us to trust them when it came down to looking out for the best interest of our children. Yet we know that the cost to send your child to daycare or college has only increased. The only thing that I can tell you that we should trust the Republicans to do is to basically play in our faces. You see, the one thing that we should do is distrust everything that they say, and that is why Democrats are here today fighting. We showed up to work because we understand that in this shutdown, we are still getting paid. Unfortunately, those that work for the federal government are not going to be paid. They are about to miss their first checks. And so it is so interesting that someone can say, we're not going to show up to work. We're not going to do everything that we can to reopen the government, but yes, you must show up. What I have to say to those hardworking federal employees and those that happen to be out sick right now is that I anticipate that a lot of people are going to catch a lot of colds in the coming days, because it seems like the only thing that these people will understand is if we have a real shutdown, a shutdown in which the people that actually make this country go start acting like the Republicans, and they just decide that they're also not going to show up, because at the end of the day, we have a president who recently said that he doesn't know whether or not he even wants to pay people when we do reopen this government. In just 8 months, Republicans have shattered an already broken public health system. Their one big ugly bill enacted the largest cuts to healthcare in American history. Texas, under Republican rule for over 30 years, already had the highest uninsured rate in the country. And now an additional 1.6 million Texans are projected to lose their health insurance. But I want to be clear about this. This isn't just about those that will lose health insurance, because at the end of the day, we all will be impacted. Everyone's healthcare costs will go up, and everyone may end up missing a hospital or a doctor because of the reckless policies of the Republicans. Just in my district, a 60-year-old couple making $80,000 a year would see their premiums increase by nearly $20,000. A family of four making $64,000 a year would see an increase of $2,571, roughly 197%. Stripping away healthcare is just one aspect of their economic and healthcare assault on Americans. They've eliminated critical funding for local health departments and community organizations doing critical public health work. So we're here today because Republicans have once again chosen to prioritize billionaires and corporations over everyday Americans. Veterans, teachers, students, law enforcement officers, members of the military, factory workers, bus drivers, all of whom will be hurt by Republican healthcare assault on Americans. I'm here today to speak for the 90,000 people in my district who will see an increase in their healthcare cost, and the millions of Texans who could lose their coverage if we don't extend the tax credits. And I wish that Republicans would put as much energy into doing their jobs and protecting healthcare of their constituents as they do into protecting Jeffrey Epstein and Ghislaine Maxwell. Maya Angelou said, when they show you who they are, believe them the first time. The final point that I'll make is that some people in this building know that I have a best friend by the name of Marjorie Taylor Greene. She even recently stated, I'm going to go against everyone on this issue because when the tax credits expire this year, my own adult children's insurance premiums for 2026 are going to double. Now, the fact that Marjorie and I agree on anything tells you how bad this is. America, it is time to call your representatives, your Republican representatives, and tell them to show up and do their jobs. Thank you, and I will yield.
Thank you.
They're saying they don't care if your health insurance goes up. They're saying they don't care about you. We're all hearing stories from all over our communities. And literally right before I walked down here today, I was speaking with a woman from Louisville, Kentucky named Ann. Ann's a small business owner. She's a real estate appraiser. She has a second part-time job to help make ends meet. She's married. Her husband's an independent contractor. And together they have a 19-year-old son who's disabled. He's had 14 surgeries at this point in his life. He sees a half a dozen specialists several times a year still. But He goes to the University of Louisville where he's a student and he lives at home. And how is Ann able to do all of this and make this work? It's because as a middle-aged small business owner who has an autoimmune disease and asthma, she has health insurance. And she has health insurance because of the Affordable Care Act. Now, is that health insurance cheap or free? No. In fact, Ann has a silver plan right now where she pays $350 a month. But it's $350 a month because there are tax credits. Without those tax credits, Ann's health insurance would be $1,275.69 per month. As she told me today on the phone, that is more than her mortgage. What does she do? She already owns her own business. She already has a second job. She has a disabled son who is able to go to college. She is terrified of what's going to happen, scared to death. She literally told me, I don't sleep. I lose my breath just thinking about it. Because while the Republicans pretend that there's no urgency to this, right now, Ann and her family are making the decision of whether or not they're going to have health care next year. Open enrollment's happening now. She has to choose. She's on the silver level plan, not the gold level plan, not the platinum level plan. She's on the silver level plan. She doesn't know how much that's going to cost next year. She doesn't know how much any plan is going to cost next year because the Republicans in Congress refuse to act. They refuse to act to bring down the cost of health insurance, to make it possible for people to start their own business, to make it possible for people to live their dreams. You know what? To make it possible for when life isn't perfect, to make ends meet and know that you can go to the doctor. So what's Ann doing right now? She's going to as many doctor's appointments as she possibly can. She is going to her doctors and asking if they have extra samples so she can stock up on medicine because next year she doesn't know if she's going to be able to go to the doctor. Like so many people across this country, when people don't have health insurance they can't afford, when they can't afford their health insurance, what's going to happen? They're going to stop going to the doctor. They're going to stop getting the preventative care. But guess what? That's not going to stop people from getting sick. And when people get sick, they're going to go to the emergency room, and that care is going to be more expensive. And it is going to be borne out by everybody. As Ann told me, she said, if I don't have health care, I won't go to the doctor. I won't get regular care. I will end up in the ER. And if you want to be cold, callous, and mean, it just costs less for you to let me have preventative care. And then she said, and I think this is the point, if you just want to be a total jerk and look at the bottom line, then actually passing these tax credits is cheaper than not passing these tax credits. So where are the Republicans? They know this is important. They know it's urgent because when Donald Trump passed tax cuts for billionaires in 2017 that were going to expire at the end of this year, they made sure to extend and expand those, calling us back in over the 4th of July to make sure it was done. Now that people's health insurance is on the table now, they are nowhere to be found. They've got to come back to Washington. They've got to work with us to open the government back up and to lower the cost of healthcare for the American people. I yield back.
Thank you very much to all of our panelists, and thank you for helping us remind the American people that we are here working and the Republicans have not shown up to work. Our next panel should make their way to the table. That includes Representative Johanna Hayes of Connecticut, Representative Yasmin Ansari of Arizona, and Representative Jimmy Panetta of California. In order of seniority, we will begin with Representative Panetta of California.
Thank you, Representative Wasserman Schultz, and thanks to all of my colleagues and of course Leader Jeffries for ensuring that we get this opportunity to talk about not just where the Republicans are, but what we need to do as a Congress, what we need to do as a body, what needs to be done for our constituents, not just in my district on the Central Coast of California, but all across this country. Now, in my limited time as the U.S. representative, I've continued to hear from my constituents, be it workers, retirees, disabled neighbors, injured loved ones, Medicare recipients, Medicaid beneficiaries, and everyone in between, that no matter how they get their health care, it's harder and harder and harder to come by and to sustain even basic health care. That's why I have repeatedly called for us to invest in our healthcare system by reforming Medicare and building on the foundation of the Affordable Care Act. Nobody in this country should have to go without health care or to struggle to find an appointment or watch one of the last hospitals in their county close its doors. But unfortunately, the one big bill that's signed into law by the president in July does the exact opposite to help those types of people. In California, the California Medical Association estimates that California will lose $226 billion in health funding as a result of this bill. The California Hospital Association estimates that in the 19th congressional district alone, there will be as much as $900 million in hospital cuts, $128 billion statewide. And every single provider I talk to, from community healthcare centers to trauma centers, the local hospitals, are absolutely terrified as to what these cuts will mean for every single patient when our doctors are forced to close their doors. I think we all understand this affects everybody. This is not an abstract concept or a far-off threat. Providers in California 19th Congressional District are already cutting services. Beginning in January, 33,000 of my constituents will see their health care costs go up. By letting the tax credits expire, walking away from this crisis is simply not an option. We're basically abandoning constituents, our neighbors, our parents with spiraling health costs, middle-class families with children, hardworking people who did everything right but still find themselves sitting in the hospital with a sick kid, or that unthinkable diagnosis that's just simply not an option. That's why we're here today. We're here because we are urging our Republican leadership in the House, in the Senate, and yes, even in the White House, to do something we've done in my limited time in Congress. Something not too abstract. Let's just negotiate. In my limited time, I've been through 29 continuing resolutions. I'm not proud that we've had to have these continuing resolutions, but I am proud that each of those CRs were a result of negotiations, direct negotiations, Democrats and Republicans sitting at the table. And you bet we have a lot to negotiate. And I want to harken back to what Representative Crockett said about trust. What you hear Speaker continuing to talk about is, well, we have till December to negotiate. You should trust us that we should negotiate. How can we trust a Republican leadership that has the cuts that they do and voted on them in the OBB? How do we trust a Republican leadership who allows this administration to make the impoundments that they've made? How do we trust a Republican leadership that makes rescissions to agreed upon spending bills? This trust comes about through these negotiations. That's why we should be here, because we need to do our part to make sure everybody comes to the table to negotiate so that we can protect healthcare, so that we can reopen up the government, so that we can reduce our costs. I think it's clear we're on the right side of this, and this is something where we need to make sure that constituents, not just in the 19th Congressional District, but constituents throughout the country, especially those in Republican districts, make sure they hold their representatives accountable, make sure they get them to the table so that we can negotiate, open up our government, and protect healthcare. Thank you, Madam Chair. I yield back.
Thank you, Congressman Panetta. Next is Congresswoman Johanna Hayes of Connecticut.
And thank you to all my colleagues for being here today, for showing up to work, just like the rest of the American people. On October 1st, as we all know, the federal government ran out of money and we went into a shutdown. My office has been open every day since then, both in the district and here in DC. And along with my staff, I have answered the phones, I have received emails, we have listened to voicemails. And overwhelmingly, people understand what it is that is happening right now. They understand the work that Democrats are trying to do to protect their health care. But there's also a sense of fear in their voices as they're telling the stories, trying to make the case, trying to help me understand. And I have to assure them that as Democrats, we do understand. And just so that we're clear, I'm hearing from people who are doing the best they can, showing up for work every day, small business owners, independent contractors, working people who have to purchase insurance through the marketplace. A couple in Danbury with an income of $88,000. They're working every day. They pay $613 currently for their health care. Their costs are expected to jump to $4,193 a month, from $600 to $4,000 a month, an increase of over $42,000 a year. And it's not just them. A couple in New Britain with around the same income, making pays now $607. Their premiums will increase to $4,286, an increase for the year of $44,000. That's half of their annual income. These are people who are already showing up to work, who are already doing everything that they're supposed to do. Last week, the Connecticut delegation did an event with Access Health CT. That is our official Connecticut marketplace. And the numbers were staggering. About 34,000 people in Connecticut will lose health coverage. About 23,000 of those people will see their costs rise. And about 108,000 people who currently receive access to nutrition programs